Thank you all for being a part of ATA's virtual conference. For me, this gathering is very timely given the changing nature of healthcare and the situation we found ourselves in today with a pandemic. One of the things that drew me to this conference was the theme, which is moving at the speed of innovation, accelerating telehealth adoption. And so today, as you visit my booth, I want to talk to you about how to build back up after a pandemic. Just to tell you a little bit about myself, my name is Chinelo Nwanwu. I am a pharmacist by profession. I do have entrepreneurial sides to me. I started PharmPH LLC, and I will be launching a new division of PharmPH, and that is what I wanted to talk to you about. So stay tuned till the end of this video, and hopefully it will be a solution that can help you and help your practice. Like I said before, I am a pharmacist by profession. I do have degrees in public health. And if you want to know more about myself, I encourage you to visit my website, which I will give at the end of this presentation. I know this looks like a busy slide, but I wanted to highlight some of the problems facing the healthcare industry today, especially our physicians and medical providers. There's no particular rhythm or sequence to how these problems are listed. Just for me, this is a summary of some of those issues that we're grappling with. The first main problem is the reduction in in-person visits due to social distancing and regulations that came with COVID. Now, if you're not a hospital, this reduction in in-person visits is affecting your bottom line even more, such that private practices and small practices with 5 physicians or less are seeing greater setbacks. And as a result of reduction in in-person visits, most doctors have resorted to using telehealth as a substitute. Which brings me to the second problem. While telehealth is a great alternative, reimbursements for these visits are lower than in-person visits, as we've all seen and witnessed, thereby leading to kind of a financial crisis because we're seeing patients, we're putting a lot of time and effort towards deploying telehealth, we're getting patients on board, and the reimbursements are unfortunately not commensurate to the time and effort being put into the process. But before anyone starts knocking telehealth and the possible underutilization that is coming from it, we also have to look at another problem, which is an awareness issue. Let's face it and be honest. How many of our patients really knew about telehealth up until COVID? How many of your patients did you see with telehealth up until COVID? So it's no surprise that when this came around, some people are going to struggle getting on board with telehealth because it's all new. And as I look through journal articles and newspaper clippings, surveys have showing that a great percentage of the population have little knowledge of telehealth. Some may have access to it through their employee health benefits, but never really had a chance to utilize it until COVID-19. Even some of you MDs at this conference that had to deploy really quickly found it to be a learning curve for yourselves and for your patients as well, because if you didn't know how to use it, you were spending time trying to get yourself up to speed before you can help bring your patients on board as well as your staff. And so that created a little bit of a problem with telehealth adoption in some areas and in some populations, especially the elderly population. The fourth problem that we are dealing with is compensation related, which is sort of related to reimbursements. Hospitals have had to decrease the amount of elective surgeries that they had to do, and these typically bring in the biggest revenue for hospitals. And we see this drying up such that some hospitals are already reporting negative margins. The patient no-shows, appointment cancellations and things of that nature are also fueling the decreased revenues. And this is affecting physician practices of all sorts, whether it's an independent practitioner or a practitioner employed by a physician network. Everyone has kind of seen patients canceling appointments or just not showing up. So where does that leave you? Which brings me to the last problem that I'll talk about, which is the uncertainty in the medical practice. The American Academy of Family Physicians had an article that showed that at least 38,000 family physicians could be out of jobs by the end of May, and that is very concerning. Now, rural areas are going to be the hardest hit, and we're already seeing that. There's already also a shortage of physicians, and it is predicted to worsen with this pandemic. But as an article in the Harvard Business Review that I read stated, one can argue that we really don't have a shortage of physicians. Rather, as a nation, we're just doing a bad job of using our current physician population efficiently. But at the same time, the current situation of things have left some physicians without a source of income or forced to retire early or perhaps consider alternative work options. So all in all, where does that leave you? Where does that leave your practice? So having looked at the problems that face medical providers and physician practices, I want to kind of provide three possible solutions as to how to address the problem. I know telehealth has accelerated, but time and time again, we hear comments that the payments are not sufficient or reduced or partially paid for and things of that nature. And still, there are decreased patient visits. So, how do we make the best of the situation while taking care of our patients? How do we find ways to keep our practices open? And most importantly, how do we keep our revenue stream coming? So I want to suggest three things. First, to analyze. Second, to strategize. And third, to monetize. And I'll get into more details as we go along. Before I get started talking about those three solutions that I mentioned earlier, I wanted to bring your attention to the quiz that's attached to today's presentation. If you have done it, that's great. If you haven't, I encourage you to take the quiz because it will probably give you some ideas or food for thought in terms of strategizing for your practice and how to build back up. And so as we think of building back up our practices after this pandemic, it is critical that we do those three things that I suggested earlier. And we're starting with analyzing your practice. Because if you take a moment to step back and re-strategize, it is possible to rebuild and come back stronger. So the first thing I suggest is to analyze your practice, take an assessment of it, and figure out what your patient mix looks like. Are you taking Medicare patients or Medicaid patients? What percentage are commercial pay and what percentage are self-pay? These are some questions that I need you to ask because when you do this, it will help you to map out where your source of revenue is coming from and if you need to adjust that balance. Now, most of us are not new to the fact that payment systems for providers in the U.S. are gradually changing. We're seeing the shift away from fee-for-service payment to value-based systems, which are more common these days. There are different models of care that are being tested to see what works. And so as all these things are happening and continue to happen, if we want to sustain our healthcare businesses moving forward, it is worth examining the dynamics of the population you serve. Do you accept Medicare patients? If you don't, what are the top 3 reasons why you don't accept Medicare? And you probably will hear me harp over and over again about Medicare because it is, quite frankly, one of the biggest payers of healthcare services for seniors here in the U.S. They do have some fee-for-service programs that are still out there that you can tap into to help your practice. If you're not currently doing it, those are things that we can share and help you get started and possibly increase that revenue source for you. So if you don't accept Medicare, what are your reasons? Is it because of too much paperwork that's involved with reporting? Is it because of lower reimbursement rates? Or is it the time that's involved in tracking metrics? Whatever the reason is, I want you to be completely honest and write it down, because we'll come back to some of those reasons later. And then you do the same for your Medicaid population and your commercial pay and self-pay. Again, like I said earlier, once you start breaking down your patient mix into these categories, it'll kind of help you get a bigger picture of your financial stream. Again, I also want you to analyze what your personnel looks like. What type of providers are you working with? When I talk about providers, I mean providers like nurse care practitioners, pharmacists, or even health educators and health coaches. Does your practice have a framework to work or contract with these individuals? Because again, these are some of the ways that you can increase your revenue stream and also increase your patient visits. And lastly, when I say analyze education services, I mean what types of patient education services do you currently have or don't have? Do you offer disease-specific management programs? Do you offer health coaching programs? Whatever it is, I'll just kind of look at your practice from a whole perspective and make those notes to yourself. The second thing I wanted to talk about is strategizing. The delivery of healthcare has changed. It has changed drastically in these past couple of months, especially with the widespread adoption of telehealth. I've heard conversations about, well, what's healthcare practice going to look like with, virtual medicine and digital medicine and telehealth and all that stuff. The question is it going to replace normal routine care? And the answer, I think, quite frankly, is no. But a few things were apparent from what we learned from COVID. There are patients that can be managed virtually or remotely. If you kind of think about your millennials that may not necessarily need to come to an office to get a diagnosis of something like a UTI maybe, those visits we can easily do with a telehealth visit. And again, there are going to be patients that will need more visits than the others. So we have to look at what that mix looks like for your practice. How do we make this work? How do we make the current situation that we find ourselves work? Perhaps we may have to take on a sort of population health approach to addressing these issues. But if we begin to analyze our patient mix by population, by age group, insurance type, etc., we can start coming up with strategies to deal with some of these problems. For instance, can my patients benefit from me adding a health coach to my practice? Can you shift some of your work from a mid-level can you shift some of your work to a mid-level practitioner, like a nurse practitioner or a pharmacist, thereby freeing up some of your time so you can focus more on certain patients or do other things that can help your practice move forward? So it all boils down to the strategies as to how we're able to move beyond this pandemic. The third solution to how to rebuild our practices as we come out of this pandemic is simply to monetize your services. In other words, getting paid for what you're already doing. If we analyze our practices, that is our patient mix, the personnel that we currently work with, or the providers that we could possibly work with in the future, then we'll begin to identify opportunities that exist within our practice. If we're able to embrace sort of the mindset shift and accept that transformation that's happening within our healthcare system and understand that we probably have to tweak things a little bit, then we can start coming up with some strategies as to how to move our practices forward. So once we have these two concepts in place, it becomes easier to see how we can monetize some of the services that we're currently offering. If you're making care plans, communicating with specialists, making adjustments to patients' regimen, and things of that nature, it is possible to weave all of these into a package where you can get paid for what you're already doing. I can't really get into all those services given the constraints that we have for this virtual presentation, but what I'm about to share with you in the next couple of slides is probably a very useful tool that will help you on this journey. Hopefully, I was able to keep you engaged up until this point in this presentation. And so I want to introduce to you Terezin. Terezin is an online membership platform, a training membership for physicians, pretty much, that helps you take care of your practice. In my mind, I think the idea of Terezin is a unique one. It may not be the first out there, but probably one of the few that's in the market. It's a premier feature, and it's born out of a passion to address a need that I currently see in the healthcare industry. So these characteristics that you see on the slide are a few adjectives I think describe what Terezin is. So what is my story? Why am I deciding to do this? Why am I deciding to launch a membership program for physicians? Honestly, the idea of Terezin came out of this COVID-19 period. It is a period we've seen where healthcare practices, doctors, medical groups had to switch up quickly to adapt their practices to what is going on. Now, I'm a pharmacist by profession. I wear many caps, if you will. I'm a public health professional. I'm also a certified health education specialist, and I pre-sub students at my place of work. And so all through the COVID period and having to get up each day and serve, listening to webinars and trying to understand all those problems that I talked about earlier in the presentation, I saw that there is a tremendous amount of work to be done, as well as an opportunity for the medical community to impact population health. Because, believe it or not, telemedicine is here to stay. It has changed and will change how medicine is practiced in this country and in the world, as a matter of fact. Because it is a virgin field, there are lots of questions and thoughts about how it will work out, how it will be implemented, used, sustained, and the fact that non-face-to-face services are going to be a crucial part of what we deliver to our patients. I decided to launch this membership to address some of these needs. I chose to offer a membership platform because I know it is going to take time. It is going to be a process. It's going to be a journey to transform how our practices are built moving forward. There will be questions, concerns, thoughts about how best to integrate telehealth services and how we can make it work for physician providers and the patient as well. The list goes on and on. There will be a need for access to curated resources and other materials that will help you build your practice as the healthcare landscape transforms. And so even with this virtual conference, there are different vendors, different products, different services that are going to be thrown at you, and sometimes it can become overwhelming. But what if you had all those resources under one roof, under one umbrella? This, my friends, is why this Terezin community is being built. So what are some of the things you can expect to be benefits of being a member of Terezin? And some of those benefits include a membership resource library that will give you access to resources, information that will help you build your practice. As a member, you will have access to discounted web-based solutions for a handful of selected services. You will have opportunities for product demos, curated resources and templates that you can use in your practice, Q&A opportunities, and much more. I put this picture up here to kind of give you a visual representation of what your success will look like once you become a member of Terezin. And like I mentioned earlier, we offer web-based solutions for a handful of services that are out there. And so if you start in stage one, where you're at the phase where you're not sure how to use a particular service, you've done your practice analysis and you figured that a particular service is missing from your practice and you want to implement that service. And so what Terezin will do for you is to provide you with resources on how you can plan for that service, and then you go on to adding on that service to your practice, and then you implement it, you learn, you grow with that service, you track your outcomes, and nothing is guaranteed as far as income is concerned. But the services that we're talking about, or I'm talking about, have reimbursement rates that have been shown to increase practice revenue. And so once you continue to implement that service, you grow your practice, and you get to stage 5 where you feel like, it's time for you to add on another service, or you're okay with what you have and it's going well. But being a member of Terezin will give you lifelong access to those discounts that you're using for the web-based solutions, and it will give you access to curated information about that particular service. And like I said, it puts everything under one umbrella for you, kind of simplifies having to go to different websites or different vendors to figure out how a particular service is implemented and run in a practice. Because this is the first time that I'm premiering Terezin, and as a reward for you guys coming to my booth today, I want to offer you the opportunity of being a founding member of Terezin. One of the great benefits of being a founding member is you will have a lifetime membership of $27 per month. I haven't decided yet when the membership will be open to other people that didn't attend the conference, but as of now, and the time that it's ongoing, the membership is set at $27 per month. And so in the future, I do foresee increasing that membership cost. You being a founding member, you get the benefit of locking it in for $27 a month, but you have to sign up before this virtual conference is over. Another huge benefit of being a founding member is that you will help shape the development of Terezin. A number of contents haven't been built yet, and so it is my vision for Terezin to be a membership that serves you. And so you tell me, or you tell us what you'd like to see, and then we'll make it happen. So that's one of the great benefits of being a founding member if you sign up today before this virtual conference is over. I have a short quiz for you. It's a fun quiz, very interactive, and about 7 questions, just to kind of help you get started in terms of doing a practice analysis, formalizing some strategies, and getting a taste of how Terezin will help you. I do want to mention that I currently have a business under FarmPH LLC, so you might get correspondence with an email that has a FarmPH, or you get some sort of correspondence from me that bears FarmPH. It is all kind of connected. So Terezin is the training membership that is housed under FarmPH LLC, just to clear up any confusions that anybody might have. For the purposes of this quiz, you can go to www.farmph.org/ATA-2020. Again, it's www.farmph.org ATA-2020. Like I said, it's about a 7-question quiz, very short, kind of fun, and easy to do. If you score between 10 to 15, you are definitely on the right track. If you score between 5 and 9, you should consider evaluating the services you're offering and probably add on a few more. And if you score less than 5, there's definitely room for some growth for you and lots of opportunity for you to work on. So go ahead and join today and become a founding member of Terezin. Like I mentioned earlier, you will get the privilege of locking in your membership price at $27 per month for the lifetime that you are a member of Terezin. So go ahead and grab that deal. For as long as you are a member, regardless of how many times that membership price will increase, yours will remain capped at $27 per month. Also, as a founding member, you do have the privilege of giving an input on how to move the community forward in terms of creating resources and things of that nature. So go ahead and join at terezin.thinkific.com. Again, is terezin.thinkific.com, and is TEDICINE.TINKIFIC.com. This promotion for founding members is only valid for the duration of this virtual conference. So if you're considering becoming a member, thinking about it, go ahead and get that deal, as it's only available till the duration of this conference. Thank you for visiting my booth today and for listening to the presentation and the video. If you have any questions, here's my contact information. Go ahead and send me an email or leave us a message, and I'll get back to you as soon as possible. I know we're all busy with conference stuff, so I may not get back to you right away, but I will definitely be in touch with any questions that you may have. Thank you very much, and I hope to see you as a founding member of Terezin.